Is Medicare free? That's one of the biggest myths out there, and today we're going to bust it. A lot of people think that once they turn 65, Medicare just covers everything automatically and there's no cost. But that's not exactly how it works. Medicare helps lower your medical costs, but it isn't completely free. Let's break it down so you know exactly what to expect. First, let's talk about Medicare Part A, which covers hospital care, inpatient stays, skilled nursing, and hospice. The good news? Most people don't pay a monthly premium for Part A. That's because you've likely paid into Medicare through payroll taxes during your working years, usually for at least 10 years. But even though Part A might not have a premium, it's not totally free. You still have a deductible each time you're admitted to the hospital, and daily copayments can apply after a certain number of days. Now on to Medicare Part B, which covers doctor visits, lab tests, preventive care, and outpatient services. Part B is not free. Almost everyone pays a monthly premium for it. In 2025, the standard Part B premium is around $174 per month, and it can be higher if your income is above a certain level. You'll also pay a small annual deductible and typically 20% of the cost for most medical services after that deductible is met. Then there's Part C, also known as Medicare Advantage. These are private plans approved by Medicare that combine Parts A and B and often include prescription coverage. With Advantage plans, your premiums can vary, sometimes as low as $0 per month, but you'll still pay your Part B premium, and you may have copays and other out-of-pocket costs depending on the plan you choose. And finally, Part D, which covers prescription drugs. Part D always comes with a separate monthly premium. Those premiums depend on the plan you pick and where you live, but the national average is usually around $30 to $50 per month. So when people say Medicare is free, it's really only partially true. Yes, Medicare helps you save thousands on healthcare costs, but you'll still have monthly premiums, deductibles, and copays, depending on the coverage you choose. The key is knowing what you're paying for and making sure you have the right plan to minimize your costs and maximize your benefits. At Lindbergh Associates, we help you understand your options and find a Medicare plan that fits your health needs and your budget. Because Medicare shouldn't be confusing, and it definitely shouldn't surprise you when the bills come in. Click the link below or call us today for your free Medicare review. We'll walk you through everything step by step and make sure you're getting the most value from your coverage. Medicare isn't free, but with the right guidance, it can absolutely be affordable.